Thanks everybody for coming by. This is our first Career Connections of this semester. We have Jamie Young with us here today. Jamie's from Liberty Hospital, and she's going to talk a little bit about kind of the careers of healthcare and careers that rely on empathy as a big part of the job. So, Jamie, if you would take it away.
Absolutely. Thank you for having me. I appreciate you guys making time. My name is Jamie Young, just like Christian said. I am the talent sourcing strategist here at Liberty Hospital. I have been in healthcare for, let's see, about 20 years now, and I've held a variety of careers in healthcare. I am a Park alum. I graduated with my undergrad there in 2012. I graduated with my degree in organizational communications, and then I also have a master's in leadership and development. So, been in healthcare a long time, but I am non-clinical. I've worked on the patient advocacy side. I've also worked in a patient navigator capacity, working with newly diagnosed cancer patients. And then I kicked off my recruiting career here at Liberty in 2018. So got into healthcare very early and never really looked back. So today I do want to share with you some content about just empathy in healthcare and what that looks like. And we all in the health system, in a hospital setting, um, I need to have empathy, whether you're a nurse or a social worker, or maybe you're in psychology or you're in sports med. I have to have a high degree of empathy as well, working in healthcare HR. So I do have a presentation put together here that I'd like to share with you. I did not create this content, but I do want to share the presentation. I do get to work really closely with our chief nursing officer. Her name is Regina Stoll, and she's fantastic to work with and just a great human. And she actually put this together and is letting me share this content with you. So let me share my screen here. We'll get going. There we go. Christian, can you still see that okay?
Yes.
Perfect. So, like I said, this is Empathy in Healthcare. I'm the presenter, and this content was created by Regina Stoll. So, when we look at empathy in healthcare, this quote really just kind of hit home. Empathy is the art of stepping imaginatively into the shoes of another person, understanding their feelings and perspectives, and using that understanding to guide your actions. And so, this is, really just important in the healthcare setting, no matter what capacity or what position or profession you're in. Just really having the perspective to put yourself in that other person's shoes and have a good understanding as to what it is they're going through. In healthcare, we are with people on some of the best days of their life, but we're also there at some of the worst days of their life. And so being able to put ourselves in their shoes is really important. So I do have a really great video I would love to share, and it's about 5 minutes. I do hope that I hope we can watch the whole thing. Christian, let me know if we need to stop it if we're kind of running out of time. But
Will do.
I would like to share. It's pretty impactful.
Okay.
Well, like I said, I really wanted to share that video. I think it's just really impactful of, what really happens, in a hospital every day. That many people are just dealing with a lot in their lives, and that is just really where empathy comes in. And um, just talking about empathy and just four qualities of that is, recognizing other people's perspective, and their perception is their truth of how that is. And we try to really stay out of the judgment zone, and being empathetic to patients' feelings and what they're going through. Recognizing those emotions in others, and then just being able to communicate that is really important. So I had said and mentioned early on, we are present in unwelcome moments, and that is very true in healthcare. Um, these pictures, I think, really just say a lot. I look at these pictures and I'm automatically have some anxiety. I get a little overwhelmed and scared and anxious and wow, what am I doing? And, these folks in these photos really relied, on this pilot to kind of get them through a very scary situation. And a lot of times that's what patients are doing. They're relying on their caregivers and their clinicians and their doctors to
Continue.
really, get them
Just
through. So, as I was saying, these photos here really just are just a depiction of just a lot of times what patients are going through. They're having a lot of anxiety. Maybe they just got some news. They're kind of feeling, extremely overwhelmed, anxious, scared, and they're really relying, on their care team and their clinical staff to get them through a really, really difficult time in their life. And so, I thought that these were, just some impactful pictures to share. And we're also, trying to bridge the gap between person and patient. So, normally when, somebody's getting ready to take a flight, they could be, very happy. They're in control, they're organized, they're excited about their trip, they're very independent. And then, translating that into, a patient setting, a lot of times, they could be very angry about a diagnosis. They could have survived, a traumatic event. Maybe they're, extremely fearful of, a diagnosis or, what can happen to them. They're not really sure. They're maybe worried about a prognosis or the cost of things. They're lonely, and that they can kind of feel hostage in a hospital situation. And when they're receiving care in a hospital, they just don't know what's going on, and that can really impact their experiences while they're in the hospital. And so that's why, having that empathetic um, quality is really, really important, as caregivers in a hospital setting. We are, present in life-changing moments for them. We're there when, trauma presents, the very unexpected has happened in their life. And um, they're being brought to the hospital and they're not sure what's going on. These pictures are very real, as a traumatic event that can happen, and they're hurt, they're scared, they're in pain, and we're there to help them ease some of that. So I wanted to share a piece of this. It's part of the Hippocratic Oath. Empathy is not a new concept or a tactic, but it's a choice. Part of this is I will remember that there is an art to medicine as well as science, and that the warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. And I think, this is, from the Hippocratic Oath for, doctors and nurses, but also, really just into anybody in the professional healthcare realm. And so this can, go all the way from, maybe that you're working, with a social workers working with a patient, or a physical therapist is working, to get a patient back to where they used to be, after an event. Maybe they're working through PT and things like that. So, really, just having that sympathy and understanding and that warmth for patients is really, really important. And then, we always think about, what patients really want from their providers as part of the care team. So, from their doctors, their nurses, their social workers, their respiratory care team, their the people that come in and, our patient access team and things like that. I mean, they want the communication, the empathy, they want the time. They want to be treated with dignity and respect. They want to be listened to. A lot of times, patients feel like, they have questions that, they don't always get answered, or they're not understanding what's going on with them. They want clinicians to really spend the time explaining to them what is really going on as far as their diagnosis, and helping them walk through that and understand it clearly is really important. Um, and somebody, that is really knowledgeable, and can, help them understand the diagnosis and the treatment and their condition. And so when we kind of think about the value of true empathy in healthcare and what does that allow us to do, it really helps us build relationships and trust. It reassures our patients, that we are there to heal them. Our patients and our customers, they feel like we are emotionally supporting them. We, are able to live out, our values and our mission as an organization. Um, and if we're, are able to understand the thoughts of our patients and helping them understand what's going on, and that helps us meet the needs of those patients. And we can really, really look back and be fulfilled in the healthcare realm, of why we, went into healthcare in the first place, and realizing just how big of an impact we make in our patients' lives every single day. So healthcare can be challenging, and it can be a difficult career to be in. But at the beginning of this presentation, I stated we are there many times with patients at their most vulnerable time, all through the life cycle. And so we're there for some of the most exciting times. We're there for the unexpected times, and some of the most hardest times in a patient's life. But um, clinicians, healthcare workers, we do, see that it is, a privilege. I have a small part in that, working in healthcare HR. And, I get to bring on clinicians and caregivers for our organization. And so kind of have a small part um, direct patient care, like we kind of all do in that regard. So we'll stop sharing here. Can you still see my presentation?
I just see you. No.
Okay. Oh, good. So, at this point, I guess I would just open anything up for questions. Questions of me, my role, Liberty Hospital. Been in healthcare a really long time, so anything that I can answer.
Go for it, Ben.
So when you personally imagine an empathetic person, what actions do they embody?
Yeah, so I really think, somebody that is truly to do a lot of active listening for patients, because they a lot of times are kind of acting sometimes out of fear and anger because they're kind of out of control as to what's happening to them. So I think making good eye contact, having those good listening skills, reminding patients, or having empathy of what we can do for them, is I think is really important.
This wasn't as much of a question, but I'm sure, especially like in a hospital, you see such a wide range of people from different backgrounds and different age groups, and like trying to navigate all of those different, even ages would be a big thing of like children behave differently than adults do, and like even adults in different like environments. So that wasn't as much of a question, but I'm sure that that's
Yeah. No, that's
it.
perfectly, that's absolutely, you're spot on there. So yes, in a hospital setting, mostly at Liberty Hospital, we're gonna, kind of cater to more of the adult side of things. But I mean, we can range anywhere from, 18 to, all the way into the geriatric population, and how we learn to communicate with those patients is very important depending on where they are in that life cycle. Yeah,
I had a question.
sure.
So definitely based on some of the photos that you shared, there's no
Mhm,
question that healthcare of all stages can be very emotionally taxing, especially when empathy is such a large part of the job.
mhm.
Have you ever found anybody who really struggles with leaving the job at work due to the heavy toll that it can kind of take on you personally? Some of these like really difficult stories that you're helping people through.
Yeah, so I actually worked outpatient oncology for about 4 years, and in my patient navigator role, I worked with newly diagnosed cancer patients. I helped them, eliminate any barriers to treatment. And so I worked really closely with social work, and that can be pretty tough because they're coming in every day, you're getting treatment, you're getting to know them, and you're getting to know their families. And it can become a very very emotional, very you are really showing a lot of empathy. And it is hard to leave it at home, right? Because you're take that home and you're wondering, did the patient get their medicine, did they get everything that they needed, how are they doing keeping up with their treatment and things like that. And I think that's where you know, having, our organization, having a good, support group for caregivers, maybe, having that support group for, we call it caregiver fatigue is what we call it. And so trying to maneuver some of those things to help remind people to take care of yourself, so you can continue to take care of our patients and those that you are in care of. So all of that is very, very important. Self-care is first. So we have to be mindful of that, and not let that take a taxing toll on caregivers and healthcare.
Great, thank you.
Mhm.
Are there any other questions before we wrap up here? Great. Well, Jamie, thank you very much for speaking with us
Yeah,
today. And
absolutely. I hope this is what you were looking for. Empathy is kind of a very large, broad topic. So that's just my perspective in
yeah,
healthcare. So hopefully it wasn't too bumpy. Sorry about all the screen sharing, non-screen sharing. So
hey,
hopefully
everybody who's
get
used
through
Zoom,
that.
I think, can empathize with
Oh
some of the screen sharing.
yeah.
Yeah,
Well, I appreciate the patience,
yeah.
but I'm happy to you guys spent some time with me today and allowing me to share this topic in healthcare. And yeah,
Well, Jamie, before you go, would you be willing to put your email in the chat in case anybody comes up with
sure.
some questions later?
Absolutely. Yep.
Great. Well, otherwise, we'd like to thank everybody who came today and for everybody who will watch this recording later on through the library. Um, if you have any questions, feel free to reach out to Jamie or you can reach out to tutoring and we can maybe get you in contact if your question relates to that. So thanks everybody for coming and have a good one.
Thank
Thank you so
you.
much, Jamie.
Bye bye.